Hello and welcome back to the second episode of the weekly Seda College podcast. I hope everyone has been well and staying safe during this COVID-19 pandemic. I'm joined again by Brianna and Michael. How are you guys?
I'm well, thank you, Annie. I think I can speak on behalf of Brie when I say this, but just trying to get through the week, taking every day as it comes. How have you been, Annie?
I am well, thank you. Just getting through this pandemic as best as I can with what is limited. Today we have a very special guest. Her name is Christiana Jozanovic. She is currently on the front line during this pandemic and works at Bella Dental Care. Today we have the rare opportunity to ask her questions about working on the front line. How are you today, Christiana?
I'm well, thanks. Just getting through these unprecedented times as best as I can.
So we have a couple of questions lined up for you today. First one straight off the bat is, how has coronavirus affected your life in terms of work?
Working in a dental practice without a pandemic going on is quite similar to one with a pandemic. To expand on this, dental practices are required by law to sanitize and clean everything the patient and us as employees touch to prevent cross-contamination. We use autoclaves and ultrasonics to sterilize our instruments and a neutral detergent to wipe down everything else that is not able to be put into the autoclave, as well as discarding disposable items. While in this pandemic, we have been through numerous restrictions, one being only seeing patients for emergencies such as sore, painful teeth. We have also been taking temperatures prior to them entering the surgery and calling them the day before to screen for COVID. Working through a pandemic in such a high-risk environment is quite stressful. While everyone is working from home, I'm exposed to particles and aerosols that can compromise one's health. So going out after work is difficult as I wear scrubs. They are considered dirty. Therefore, they need to be taken off before I sit or lay on something clean. They had to be cleaned every night, so Mum wasn't happy about that. Most of my friends work with me, so socializing wasn't that difficult.
Which approach to health promotion do you think is most efficient COVID-19 and why?
Definitely hand hygiene. Although it is something so simple, not everyone knows how to correctly wash their hands. If you are not from a medical background, then chances are you were never taught how to correctly wash your hands. It is something so easy yet super effective in minimizing the transmissions of viruses, bacteria, germs, dirt, and other harmful and unwanted substances that stick to the hands.
Well, you heard it here first, guys. Christiana saying hand hygiene is the best way of health promotion during these times, and I would 100% agree with her. Well, that wraps up the end of this podcast episode. Christiana, thank you so much for coming on and speaking to us personally about your situation. We do appreciate your valuable time. Thank you everyone at home for listening to this week's podcast. Please stay tuned for our next one. Stay safe and we'll see you later.